Does social status have a direct influence on the development of health conditions from alcohol problems? An intriguing question that's been picked apart in a recent study conducted by Alexis and her team at Virginia Commonwealth University in the United States. This study, published in the open-access journal PLOS Medicine, has shed some light on the complex interplay between social status and alcohol-related health conditions. According to the World Health Organization, harmful alcohol use is responsible for 5.1% of the global burden of disease and injury. It's a staggering statistic that translates into 3 million deaths each year. In addition to the health implications, excessive alcohol consumption also has an economic impact, affecting both individuals and societies at large. Previous research has drawn connections between a person's socioeconomic status and their alcohol use. However, the implications of these findings have remained somewhat murky. Specifically, how does an individual's social class impact their future risk of acquiring alcohol-related medical conditions, such as alcoholic liver disease? To untangle this complex issue, Edwards and her team turned to a model that tracks individuals over time. They used two indicators to gauge socioeconomic status: income and education level. They then analyzed data from over 2.3 million individuals in a Swedish database. What they found was striking. Men and women with a lower income or education level were more likely to develop health conditions related to alcohol abuse. This correlation held true even when the researchers controlled for other relevant factors, such as marital status, history of psychiatric illness, and genetic predisposition to alcohol abuse. These findings hold significant implications for understanding which populations are most susceptible to medical conditions resulting from alcohol abuse. They also contribute to the growing body of literature on health disparities that stem from socioeconomic factors. So we circle back to our initial question: how does an individual's social class impact their future risk of acquiring alcohol-related medical conditions? The answer, it seems, is intricately tied to income and education levels. But there's more to this story. Let's delve deeper. To understand this correlation, researchers used a unique model that follows people over time. This approach allows us to see the trajectory of an individual's life, rather than just snapshots of their behavior. The model is a bit like a time-lapse film, capturing the ebb and flow of life circumstances and their effects on health outcomes. The researchers chose two indicators to represent socioeconomic status: income and education level. These are both tangible measures that can be tracked over time. Income is a straightforward indicator of material wealth, while education level often correlates with opportunities for higher-paying jobs and overall quality of life. The data pool for this study was notably extensive. The researchers analyzed information from over 2.3 million individuals. That's a population larger than the city of Houston. This data was drawn from a Swedish database, providing a broad cross-section of society to study. Now let's talk a bit about how the analysis was carried out. The researchers didn't just look at the raw data, they also accounted for other relevant factors that might influence the results. These include marital status, history of psychiatric illness, and even genetic predisposition to abuse alcohol. By controlling for these factors, the researchers were able to focus on the impact of socioeconomic status on alcohol-related health conditions. After all this meticulous data gathering and analysis, what did the researchers find? Well, the results were quite revealing. They found that both men and women with a lower income or education level were more likely to develop conditions related to alcohol abuse. This correlation held true even when other factors were taken into account. In essence, the meticulous methodology of this study allowed for a more nuanced understanding of the relationship between social status and alcohol-related health conditions. It's not just about how much money you make or how many degrees you have, it's about the complex interplay of socioeconomic factors that can shape a person's life and health. Both men and women with a lower income or education level were found to be more likely to develop conditions related to alcohol abuse. This finding underscores the need for targeted interventions and policy changes to address health disparities in our society. The findings of this study are eye-opening and carry significant implications. Delving into the outcomes, researchers analyzed data from over 2.3 million individuals in a Swedish database. Their focus was on two indicators of socioeconomic status: income and education level. What they found was both astonishing and concerning. Men and women with lower income or education level were more likely to develop health conditions related to alcohol abuse. These weren't just minor correlations either. These associations held true even when researchers controlled for other relevant factors such as marital status, history of psychiatric illness, and even a genetic predisposition to abuse alcohol. What does this mean? Well, it reinforces the idea that social class plays a significant role in our overall health, particularly when it comes to alcohol-related conditions. It's not merely about individual choices or genetic predispositions, but about the broader socioeconomic context in which people live. The implications of these findings are far-reaching. They help us better understand which populations are most likely to suffer from medical conditions resulting from alcohol abuse. We're not just talking about the common conditions such as alcoholic liver disease, but also other medical conditions that can drastically reduce an individual's quality of life. These results give us a clearer picture of the health disparities we see in society. They show us how these disparities are not just about access to healthcare or lifestyle choices, but also about the social and economic conditions people find themselves in. It's a stark reminder that health is not just a personal issue, but a societal one. These findings contribute to a growing body of literature on health disparities that stem from socioeconomic factors. They emphasize the need for a more comprehensive approach to tackling health issues, one that takes into account not just individual behaviors, but also the social and economic conditions in which people live. It's a call to action for policymakers, healthcare providers, and society as a whole to address these disparities and work towards a healthier future for everyone. But what does this mean for individuals with lower income or education levels? Well, the implications of these findings are quite significant. The researchers of this study suggest that those with lower income or education may need additional attention when it comes to the evaluation of their alcohol consumption and identification of related conditions. In essence, the onus is on healthcare professionals to recognize this heightened risk among individuals of lower socioeconomic status and to take proactive measures. These measures could include more frequent screenings for alcohol-related health conditions and potentially a more in-depth investigation into their drinking habits. Early detection of these issues can lead to timely interventions, which could potentially prevent the progression of alcohol-related conditions. This is especially important considering that these conditions, such as alcoholic liver disease or alcoholic cardiomyopathy, can have severe life-altering consequences. However, the responsibility doesn't just lie with healthcare professionals. Society as a whole needs to contribute to reducing these health disparities. This could involve creating more accessible and affordable treatment options for those of lower socioeconomic status. Education also plays a key role here. Awareness campaigns targeted at these high-risk populations could help in shedding light on the dangers of excessive alcohol consumption and the importance of seeking help. Moreover, policymakers can play a pivotal role too. They could implement strategies that target the root cause of these health disparities, such as improving access to quality education and creating better job opportunities for those in lower income brackets. By tackling the problem at its source, we can hope to see a decrease in the prevalence of alcohol-related health conditions among these vulnerable populations. In conclusion, this study underscores the need for a comprehensive approach to tackle the issue of alcohol abuse and its related health conditions. It's not enough to simply acknowledge the problem. Actions must be taken, and they must be taken swiftly. Among individuals with an alcohol use disorder, those with lower levels of education or lower incomes are at higher risk. Therefore, additional screening and prevention efforts may be required to reduce health disparities. The time to act is now. We owe it to these individuals and to society as a whole to ensure that everyone, regardless of their social status, has access to the healthcare they need and deserve. This study sheds light on an often overlooked aspect of societal health. It's crucial to digest the implications of this research, not just as numbers and percentages, but as a reflection of our society and the health challenges faced by individuals with lower income or education levels. The findings underscore an alarming disparity, where these individuals are more likely to develop medical conditions related to alcohol abuse. Let's revisit the key points of this study. The researchers used a time-progressive model and two key indicators of social status: income and education level. They analyzed data from more than 2.3 million individuals and found that both men and women with lower income or education levels were more likely to develop alcohol-related conditions. These associations remain true even when other factors like marital status, psychiatric illness history, and genetic predisposition were taken into account. What does this tell us? For one, it underlines the need for more awareness and understanding of how socioeconomic factors can influence health outcomes. It also emphasizes the importance of targeted interventions and prevention strategies for those most at risk. However, this study is just a piece of the puzzle. It's a step towards understanding the complex interplay between social status and alcohol-related health conditions. But there's still much to learn. Further research is needed to delve deeper into this correlation, to pinpoint other contributing factors, and to develop effective strategies that can mitigate these health disparities. As we grapple with these findings, it's important to remember that they are not just about alcohol, nor are they only about health. They're about people. They're about the societal structures that shape our lives and the inequalities that persist within them. They're a call to action. As we continue to explore the intricate relationship between socioeconomic status and health, we must strive to address these disparities and work towards a healthier society for all. Because health isn't a privilege for the few, it's a right for everyone. And it's high time we took steps to ensure that this right is upheld regardless of one's social standing.